This brief lecture will cover respiratory health, both how to maintain it and the diseases in respiratory health. So, be able to define the Heimlich Maneuver, CPR, mesothelioma, bronchitis, sinusitis, meningitis, emphysema, cold and flu, and COVID-19. List environmental hazards to respiratory health. Describe public health issues related to the respiratory system and compare causes and symptoms of diseases of the respiratory system. First off, let's look at some aid. Specifically, we're going to look at a maneuver known as a Heimlich maneuver. If you remember from our previous lecture, we mentioned the trachea can be obstructed and the coughing will actually constrict the trachea in order to make the airflow go quicker, but sometimes this coughing doesn't work to get things out of the trachea, which is when you're going to do a quick thrust upward and inward over the person's belly, therefore reducing the volume of the lungs and forcing air out. The sudden air pressure without the trachea squeezing, as it does with a smooth muscle, can be more successful in getting objects out. This is one reason that Cheerios are so popular, is because Cheerios can be eaten very well without necessarily obstructing the small trachea of, say, infants. And here are some possible alternatives to different types of things that infants choke on. They put everything in their mouth and they don't really think about it, which is, it's just what an infant does. So here are some possible alternatives. And don't ever lay an infant on the ground and do CPR on an infant. Heimlich-wise, you just do back thrusts between the shoulder blades with one hand, turning the baby over and do chest thrusts there. This can be done till the choking object comes loose, of course. And I want to point out these little Legos here. These Legos have a little hole in the top, and they get perfectly stuck in the nostril of a child. You can always ask me about that and tell a story in class, but not on this lecture. This lecture, we're going to move on to CPR, which is the keeping the heart and the lungs functional. The CPR is actually compressing the heart by these quick compressions, and that moves the blood around. The rescue breaths you do will provide a little bit of oxygen. The goal here is staying alive, and you can remember that because the beat to which you do chest compressions is staying alive. Or if you don't like that Queen song, you can do Another One Bites the Dust. Exposure is something that the Heimlich maneuver and the CPR cannot stop, and exposure can come to different types of pollutants, one of which is asbestos. Asbestos is a fireproof fabric-like substance that has small fibers. These fibers can go in the lungs pretty easily. They can become airborne as a fragment. When they are in the lungs, they can cause lung cancer known as mesothelioma. So asbestos is found in fireproof insulation. That's not the fiberglass insulation. It's a different type. It's also found in car brake pads, so because it doesn't heat up and catch fire. Asbestosis is scar tissue in the lungs after asbestos exposure, and the mesothelioma can take years to develop. Urban pollution is another health problem, and this is caused by certain particulate matter. So smoke given off in urban areas, if you see someone rolling coal down an urban road, that can be particulate matter. There's also ozone, which is a type of pollutant, lead from gasoline. If you don't live in an area with unleaded gasoline, the U.S. has unleaded gasoline, but not everywhere has this, and lead from the gasoline can actually enter the body via the lungs and binds to things in neurons. Weakened lungs, like those who have been exposed to urban pollution for a long period of time, are at more risk for infections. We'll cover some infections later, but it can be things like bacteria, parasites, and chemicals. No, chemicals can't infect. Bacteria and parasites can. There is a level of inequity in air pollution, and we are going to cover this in class. So since there is social work people in this class, they will be covering this in a bit of a discussion, but not here online. Smoking and vaping are also types of exposure to chemicals in the lungs. So although smoking has gone down in high school students, vaping is going up and rapidly. So what kind of things can smoking do? Well, smoking itself causes problems in the lungs by destroying the cilia and by increasing the mucus production. You may remember from the previous lecture that more mucus means it's going to be more coughing to get rid of it. And that's especially going to be true when the cilia aren't naturally moving the mucus out of the lungs. The mucus is just being produced because there's more particulate matter. The mucus is supposed to get the particulate matter, and the cilia are supposed to move the mucus out. But without cilia, you don't move the mucus out until you have to cough. This can also lead to infections in the mucus pools, leading to lung infections as a side effect of smoking. Other respiratory disorders are plentiful, so let's go through these. First off is asthma, spasmodic contractions of the bronchial muscles, increased mucus production, often occurring in attacks triggered by allergens, exercise, or irritants in the air. So people are prone to this, and it can be stopped with an inhaler. Bronchitis is a chronic inflammation of the bronchi or an acute inflammation of the bronchi, often caused by pollution or by bacteria. This is common in Americans that go to places like India where there is more wood smoke in cities, and that can lead to acute bronchitis and a very raspy voice when they return. Sinusitis is a similar infection here of the sinuses instead of the bronchi. Cold, also known as rhinovirus, is a whole bunch of different types of viruses, and this is why there's no cure for the common cold, because there's no single common cold. They are infections, mostly of the upper respiratory tract, taking from several hours to a day latency period, meaning from the time that you are coughed on till the time that you actually feel like you have a cold can be several hours to a day, but not very long. This cold virus is highly contagious, but not very dangerous. So most people just walk around, go to work, go to school, go to class with a cold virus, and it spreads very well. In susceptible individuals, there can be complications. Meningitis is an infection in the nervous system. So why cover it here? Well, because it can come as a result of infections in the respiratory system. Emphysema is permanent damage to the alveoli, making them less elastic and making the bronchi less elastic so they don't stay open properly. You saw the effects on vital capacity in a previous lecture. It causes a reduction in surface area for oxygen uptake, and thus oxygen will not be taken up as easily, which can mean the individual will have to breathe more. And this is most commonly due to irritants. The flu, or influenza, is from several different influenza viruses. It's similar to a cold, but has fever and headaches and muscle aches in addition to the upper respiratory problems. The flu generally has a 2-day latency period, so if you're exposed to someone who's coughing and you get sick hours later, probably a cold. 2 days later, probably the flu. The flu is very dangerous. Well, it's contagious. It's occasionally dangerous and often leads to complications in individuals who are susceptible to it. Pneumonia is one of those complications. It's a result of viral or bacterial infections leading to excess fluid in the lungs. It can be diagnosed by yellow-green mucus and blood in the mucus. Frequently does cause death. Most cases will go away, but this is actually a very common cause of death. And last is COVID-19, a coronavirus identified in 2019. It's not like it's the 19th version of something. The latency period here is tricky. It's very different between different variants, being anywhere from 0 to 14 days. The symptoms are also very tricky, varying in severity, allowing for a greater spread to other individuals. And we have seen higher death rates in older individuals, but since 2020, we have actually seen the death rate going down drastically. This is what happens when it gets into your lungs and causes an infection. Here, you can see the damage that is being done by COVID-19. This is a particularly bad case. Other cases can range from not any symptoms at all to, oh my goodness, they're dead. So there is a wide variety of what happens with COVID-19. The virus is still evolving, but it's no longer such a bad threat. Last off, as far as disorders go, would be lung cancer. Chronic exposure to carcinogens will lead to cancer, and you would put mesothelioma under the aegis of lung cancer. This impairs oxygen transfer, and it can metastasize, meaning going into different tissues. Lung cancer very commonly kills the individual. It can be diagnosed by a chronic cough, a painful cough, and blood being coughed up.